We now return to NC Span.
Three significant health care issues are what we're talking about this week. So while we're on the subject of the Affordable Care Act, let's deal with the expansion of Medicaid provision in the ACA. Since everybody's required to have health insurance under this new act, understand many can't afford insurance, so the ACA provided for an expansion of Medicaid. What was the criteria for determining who's going to be included in that Medicaid expansion, Lanier?
Well, basically, it created the rule that up to 138% of the federal poverty level, you were going to qualify. Right now in North Carolina, we have what we call categorical eligibility. There's one set of rules for children, there's another set of rules for pregnant women, there's another set of rules for the aged and disabled, and there's other categories in there as well. But basically, in our North Carolina Medicaid program, we don't really provide coverage for anyone between the age of 21 and 65 unless they're disabled or pregnant or medically needy, which means it takes every dime they have to take care of their medical needs. And so what this would do would expand Medicaid to basically cover individuals between the age of 21 and 65 up to 138% of poverty, which we do not currently cover.
Roughly, what is that? 138%?
138% of poverty is
26, 27.
Yeah,
poverty is 27.
Right.
Yeah,
Yeah,
it's a family of four. Yeah, it's around $30,000, something like that.
Okay.
And so it would provide that, so it'd get away from the categorical where we have a broader base of coverage.
Now, these people below 138%, do they get subsidies on the cost of the insurance?
Well, the people below 138% would be in Medicaid, so it'd be totally paid for.
All right. So under the circumstances then, the federal government said they were going to pay for the cost of this expansion. How's that going to work?
For the first 3 years, they were going to pay for the cost of that expansion.
100%?
100%. And then it would begin to require the state to make some payment to where that number would drop from 100 to 90% over a period of several years. Currently with Medicaid, the federal government pays about 2/3 and the state pays about 1/3. So this would be more federal payment than would be under our normal Medicaid program.
Now, under the original ACA that was passed with this expansion clause in it, correct me if I'm wrong, I understood that the states were told if you don't participate in this expansion of Medicaid, then you're potentially going to lose all your Medicaid funds. But the Supreme Court ruling earlier this year said that, wait a minute, you can't do that.
We started out after the passage of the Affordable Care Act, started out under the understanding we would be expanding Medicaid. But with the Supreme Court ruling, basically it was decided that if the state did not expand Medicaid under the Affordable Care Act, it would not jeopardize the existing Medicaid program and funding was there. In other words, they couldn't threaten to take away existing funds if we did not expand. And as a result of that, there's a lot of states that are looking now at not expanding.
Well, help me with the math here, because you've said before that if this expansion of Medicaid takes place, that North Carolina could see as many as 500,000 new Medicaid patients. Is that correct?
Yeah, there's two pieces to this. One is the mandated coverage. We're estimating there's maybe as many as 200,000 people in North Carolina who would currently be eligible for Medicaid who's never enrolled in Medicaid. And so if they were mandated to enroll, that gives you 150, 200,000 more coverage based upon the last numbers I've seen. And then the expansion would add somewhere between 400,000 and 500,000 more people to the program. So you would have somewhere in total expansion up to 600,000 plus, which right now our Medicaid program is about 1.6 million. So you'd be increasing it by over 1/3.
Now, you've said that the states have the option whether to participate in this expansion of Medicaid or not. So let me ask you, what happens if North Carolina decides we're not going to participate?
Well, if North Carolina decides we're not going to participate, then we continue on. And I think this is going to be a real
Well, what happens to those 600,000
Well,
people?
they continue to have no insurance just like they do now.
But they're required by law to have insurance.
Well, then the question is okay, would they qualify for the exchange? Because again, the way the exchange would work is you apply for Medicaid, and if you don't get Medicaid, you go into exchange. The problem is how the subsidy would work in that group where the Affordable Care Act considered them being a part of Medicaid, but actually they wouldn't be, and where they would fit into that picture. So there are some questions. And with the legislature right now and what they may do with this, is going to be very interesting because a big struggle with the legislature is controlling the Medicaid budget and whether or not they expand the Medicaid program, which initially would be funded by federal dollars, but I think there's a fair amount of mistrust about can they depend upon the federal government to do this.
Well, I was going
long
to
term.
say, I mean, at first blush, you take a look at this and you say, hey, wait a minute, at least for the first 3 years, this isn't going to cost North Carolina a dime. Why wouldn't we take advantage of this expansion of Medicaid?
I think it's after the first 3 years is what legislators will be worried about. Now, let me just mention one other thing. With the Affordable Care Act, there's other kind of funding, like funding that goes to hospitals, et cetera, that's scheduled to disappear. Hospitals, et cetera, are really looking for this expansion of Medicaid because they need some way to make up the dollars that are being lost in other parts of the Affordable Care Act.
In their emergency departments.
And so the expansion of Medicaid, while I think it's the legislature right now is going to take a lot of convincing to do it, I think there's going to be a lot of folks out there pushing them to do it, and it's going to be a very interesting debate.
I'm going to put you on the spot. You're more knowledgeable about this than most people. What's your prediction as to what Governor McCrory and the legislature are going to do with this?
I really doubt that we'll see a Medicaid expansion in this next session. I may be surprised, but I think there's going to be people looking at it. There's going to be advocates for it. But I think until they get a better feel for where Washington's going with their deficits and how they may cut funding in Washington, I think they're going to be very reluctant to expand the program.
You guys, again, you're over at the legislature on Jones Street. You're talking to people all the time. John, what's your take on this?
I think that Lanier's assessment is accurate, that there isn't much sentiment for it at the moment. And I think if you look across the country, there's a whole lot of different ways that states are responding. As Lanier was getting at, there's some interesting interactions between the Medicaid expansion part and the exchange part, because the exchange subsidies kick in, I think, at 100% of poverty. Mm-hmm. There's a belt of potential recipients. In some states are already eligible for Medicaid. States might figure out a way to get them off of Medicaid and into the exchange where the states are not paying for any coverage and never will. So there's all sorts of different interactions here.
I'm not sure there's political will yet. I think there will be once people realize, and the people in North Carolina realize, and the hospitals and the providers realize, you know, we haven't talked about the fact that we'll have 500,000 to 600,000 people who don't have health insurance now who will have it. That's what the Affordable Care Act is all about. Even Tea Party governors like Rick Scott is in Florida is now thinking, oh, I don't know, maybe this isn't such a bad idea if we can cover 500,000, 600,000 people in North Carolina for 3 years. The federal government pays the whole cost, 90% of it after that, as far as we know. That's a hard thing to turn down when so many people need health care and so many healthcare institutions need the money.
We got 1.5 million people in North Carolina that aren't insured. Lanier, the Congressional Budget Office says ACA is going to ultimately end up saving money for the country. How's this going to work?
Well, you know, I've been trying to figure that out. The healthcare system overall is continues to grow. The financing of it continues to grow. I mean, healthcare is big business. It's over 10% of the jobs in North Carolina. It's the 5th largest piece of our economy. It's big business. And whenever you're starting to look for ways to reduce the federal budget through Medicare or whatever, reduce it through trying to control Medicaid, unless the big business changes, then you got to figure out how you make those dollars up somewhere else, and then where does that shift to, and how does that shift? So, you know, we talk a lot about Medicaid, we talk a lot about Medicare. I think that the issues we have with the budget in those areas are a symptom of the larger problem, and that's how do we really control healthcare costs.
Our healthcare system in North Carolina, and you've been good enough to be on a panel with us and continue to serve with us in working on that. After these messages, we're going to take on topic 3, Medicaid reimbursements. It's important. Stay with us.